Broadcasting from the Cass Corridor in Detroit, this is The Metro. I'm Robin Vincent.
And I'm Tia Graham. Today on the program, a new campaign is raising awareness about vulnerable kids facing abuse and the need for juvenile justice reform.
Plus, Highland Park residents have been facing ongoing water issues, including 2 recent boil advisories. So what's the city doing about it?
And chronic absenteeism is a big nationwide issue, and the number of frequently absent kids in Detroit is especially high. A new book suggests ways to rethink the problem.
But first, in the U.S., accessing the healthcare you need hinges on many factors. And even when you're well-resourced, when you have insurance, when you know how to advocate for yourself, the medical system is still a confusing, sticky web to navigate. Now, imagine you don't have mastery of the English language, that you come from a culture where your customs don't align with many American ones. And on top of these obstacles, what if you don't have insurance or you're having trouble making ends meet? These are some of the roadblocks that immigrants in the U.S. face when they're trying to access health care. WDET reporter Nargis Rahman puts some of these dilemmas into sharper focus for us. Her new 4-part series explores how Bangladeshi women are trying to access healthcare in Metro Detroit and what barriers stand in their way. What she found speaks to broader issues with healthcare access that many people in immigrant and underserved communities face. Nargis, welcome to the program. So first, Nargis, why did you want to report on this topic?
Well, as someone who's Bangladeshi American, I notice these types of underreported stories and think it's really beneficial to bring awareness to these issues because, like you mentioned before, these are common themes that happen across immigrant communities. And the more aware we are of these issues, it reduces the burden on the Bangladeshi people themselves to try to address some of these needs, which they might not even know how to articulate in the first place.
So you're coming at this from a personal place as well. Talk a little bit more about that.
Yeah, as someone who grew up in the Bangladeshi community as a Bangladeshi American, there are a lot of things that I've noticed along the way, like people around me who are facing some of these barriers. And as a reporter on the other side, it's really interesting to me to see that these barriers continue to be problems for people decades later, even though there are people who are working on the ground to address them. There's just still a lot of institutional knowledge that's not there on how to reduce these barriers. And so I think that talking about these and bringing these topics up shows that there is progress happening behind the scenes. However, there is still more work to be done.
It also hits home as to why it's so important to have diversity in your newsroom, because you're coming from a community where you understand some of the problems, some of the barriers that people in your community are facing. And so that makes you especially suitable to report on this topic. Now, when it comes to navigating the healthcare system, I want to look at mastery of the English language, which is crucial. There are lots of nuances in the way that healthcare workers speak about our health. What did you learn about language access for Bangladeshi women?
So one of the things that I noticed is that despite all the strides that people are making, language access is the number one issue to this day for the Bangladeshi community, especially for Bangladeshi women. But, language takes on a lot of different factors. It's not only about learning English in itself. So in Metro Detroit area, there are interpreters in the healthcare system who speak in Bangla interpretation. So the most common version of Bangla that you'll hear if you're going to the doctor or you do need an interpreter is in Shuddha Bhasha, which is basically like standardized Bangla. And so it's textbook-like. So a lot of people might know how to read it, but they might not comprehend it on an everyday language basis. And so the people in Metro Detroit mostly speak Sylheti, which is a different dialect. And so even though they might have these interpreters available in theory, they may not still receive the translations that they need.
So you're saying that one dialect is extremely formal, and then the other one is more the dialect that people are speaking on the streets, and so this presents an extra layer of problems.
Absolutely. And, and sometimes we'll see that people are taking their own family members or kids to translate for them. And so in absence of, having that interpretation available to them in a way that's meaningful, there are people who are stepping in. However, a lot of healthcare workers told me having a family member translate isn't always the best way to get that information, because in some cultures like the Bangladeshi culture, there's a lot of filtering that happens. So if there's like an older person with an illness, sometimes they don't want to tell their parents, hey, you have cancer or you have a illness, because it really it might impact their healthcare and their ability to take in that information emotionally and physically. And also it hinders the way that person is being cared for, because sometimes they're not receptive to getting that care.
Okay, so talk to us about some of the people that you spoke with about this.
So one of the people I spoke with is Dr. Subha Hanif. She's a cancer rehab fellow at the University of Michigan. In 2012, before she even started med school, she was doing these healthcare workshops for Bangladeshi women, because she noticed that there was this gap in understanding some of these healthcare terminologies, and that Bangladeshi women needed their own space to learn these things on their own. And like many cultures, there's a level of privacy. Like we don't, want to go talk about reproductive health in front of a bunch of guys. And I think that's common in even American culture to some extent. So we don't want, men explaining to us how our body works. And so she really understood that and understood the layer of needing that interpretation service on the spot, and bringing in female healthcare providers to talk about these things in a very culturally sensitive space. But also the funny thing is, back in 2012, this was not like a normal thing, right? So she had to do a lot of hand-holding with the uncles and the elders in the community and say, please send your wife, your daughter, your mothers to these healthcare workshops, and we're going to be able to empower them to ultimately take care of themselves better so they can take care of the rest of the family better as well. And recently, there's more efforts to have these types of healthcare workshops. And I think that now as a community, there's more receptiveness to having these types of healthcare workshops for women. So at the Detroit Friendship House, they teamed up with Eastern Michigan University's Racial Ethnic Approaches to Community Health Program, or REACH. And they said, how can we better address some of these barriers? And what are the things that Bangladeshi women need to know about? What is the information that they're not receiving? So things like how to get a mammogram or how to get a pap smear done to prevent breast cancer or cervical cancer and things like that. So I spoke with Khurshida Hussain, who is the executive director, who said it's important to empower women themselves, to advocate for themselves, while pairing direct enrollment services and helping people kind of learn how to navigate healthcare on their own.
Having them enroll on the spot and explaining those medical terminologies, or having someone that can translate that on the spot, makes it more accessible, rather than having just a workshop and saying, okay, now you have to go here downtown somewhere to enroll and speak to a certain person. That's very disconnected and very intimidating.
Let's talk about a term, Nargis, that plays a role in how Bangladeshi women access healthcare. And I think so far what you've been describing sort of hits on this, but I want you to really define it for us, and that is cultural competency. What does that mean?
Well, to me, it means acquiring cultural knowledge and acknowledging cultural norms within a community without burdening people to assimilate and to change their ways just to get their needs met. So really, it's kind of meeting people where they are. And so as we heard, this is as simple as creating women-friendly spaces or understanding the roles of women in their households and how that impacts their health. So during the pandemic, for example, family nurse practitioner Farzana Noor noticed that there was a lot of women who didn't have primary health care doctors all of a sudden, and she was able to take on some of those people as patients, because she was saying they're taking care of everyone else in their house, but they're missing all these really crucial screenings for themselves. And she wanted to be able to fulfill that need in some way.
And this sounds like something that is something a lot of women often fall victim to, is taking care of everyone and maybe not necessarily taking care of themselves. And you spoke with a medical interpreter. Tell me about that.
One of the things that the medical interpreter said is that, There's a lot of cultural family dynamics that people bring to the table when they're coming to the doctor's office that sometimes doctors don't realize in terms of, wanting to have other people from their family in the same room while they're getting the care that they need, and being able to look to a family member and say, is this the thing I should be doing? And looking to a family to the doctor themselves and saying, is this the right treatment that is best for me? And so some of those things is just understanding how people are approaching healthcare to be able to lessen the burdens for themselves, but also teach them how to advocate for themselves at the same time.
And that interpreter, she's also a medical student. Her name is Rumia Rafiq. Is that right?
Yeah. So she volunteers at the Huda Clinic, and she was saying that some of these limitations and challenges kind of hinders how people are taking care of their health.
Our cultures are very communal and very family oriented, and it's a little bit different from the Western idea of individualism. And I think that makes it difficult sometimes for Bangladeshi women who want to have their family as a part of their care. Practitioners not really understanding, like, why is this person answering this question for you?
This is the Metro on WDET. We're discussing healthcare and healthcare access for some immigrants in Metro Detroit, specifically Bangladeshi women. Our guest is WDET reporter Nargis Rahman. She published a 4-part series on this underreported topic called Shusto. You can find it at WDET.org. Now, Nargis, what are some solutions to getting more Bangladeshi women the healthcare that they need?
So one of the barriers that I found in my reporting is affordability. So the health unit on Davison Avenue, or more commonly known as the Huda Clinic, is the largest free healthcare clinic in Wayne County. They serve underinsured and uninsured patients, about 5,000 people or so each year. And, what I learned is that they serve about 30% of Bangladeshi women specific in that population. What they have said is that, a lot of people who work there say that they need more Bangladeshi doctors, interpreters, and staff to make the process smoother for Bangladeshi women. The whole place runs on volunteers. So it's really kind of comes to people stepping up and providing the service for people. But other people have also said when there aren't Bangladeshi women available, there is a need for female staff in healthcare to be able to meet the needs of Bangladeshi women. And so just a small example is like if there is an opportunity for a female doctor to do a pap smear versus a male doctor, that just makes people feel just one step more closer to comfort, and be able to take care of that. Dr. Nashita Mullah says, women are just more receptive to female healthcare workers, especially if they're Bangladeshi. And that way, if they have any questions or they have to take any tests, they're a lot more comfortable in doing that. Another example is in Dr. Farjana Alam, who serves at emergency medicine at 4 hospitals in Metro Detroit. She says there's a lot of social determinants of health which really negatively impact healthcare for Bangladeshi women.
You can't compare someone like a white female who has all the resources in the world, who has all the money in the world, her health outcomes to someone, this Bangladeshi female who barely finished school, who has all these financial constraints over her. You can't compare those health outcomes.
And, just what Farzana Alam is talking about is social determinants of health. So where you live, what kind of insurance you have, the economic background you come from, all those things really impact your health. And that is true for many immigrant communities or communities in general, especially even in Detroit, where there is a lot of disadvantages of how you get your health care. And it has nothing to do with who you are personally, but it has a lot to do with where you are in the place of where you live, and all the access is not as equitable as in other places. So, but one of the things that Farjana Alam said, which I thought was so beautiful, and she also described this as someone who grew up in a home of immigrants and had to help her parents navigate the healthcare system when she was younger, is that women in the Bangladeshi culture are so resilient. Like they're going out and getting their, they're taking ESL classes and they're learning English, they're learning how to drive, they're learning how to navigate these systems in their own way, in their own pace. They're also educating their children. Like herself, she was saying that her parents were a very big force behind her becoming a doctor. And so they're finding ways to create this resilience within the community to then ultimately help themselves.
But Nargis, it sounds like that's a lot of weight on these women's shoulders. And it makes me think about mental health, which is something that is still more stigmatized, broadly speaking, in the U.S., although that is changing a little bit. So I do want to talk about the barriers to addressing and accessing mental health care for Bangladeshi women. And we know, again, mental health is something that it's stigmatized, but especially so in many minority communities. What did you learn about how Bangladeshi women are addressing mental health?
So one of the biggest things is the generational difference. So younger generations are a lot more open to receiving mental health care services. However, older generations are still very resistant to having that service. So one of the counselors I spoke to, Shurat Chaudhry, she said that stigma is still the biggest reason that many people are not seeking care. And in the absence of that, younger generations are signing up their parents or their in-laws to get care, but they're still not showing up there sometimes. And the younger generations are really in this push and pull system of wanting to be independent and have their individuality and in growing up in cultures that are very collective and family oriented. But she didn't realize that there was such a lack of mental health care professionals in the Bangladeshi community until she became a counselor herself. Similarly, Fariha Ghazi, who sees a lot of female patients, says that a lot of people come to her after they have physical symptoms and are seeing primary care doctors for some of the mental health care needs.
And it often presents as like kind of physical symptoms first for them. And, when they go see their like general primary care provider, they're often treated for things like stomach pain or acid reflux or, given sleep medication to help with sleep. The kind of root cause of a lot of those physical symptoms, it tends to be anxiety and trying to get them treatment for it.
So, you hear Fariha Ghazi talking about women not even being able to talk about their own mental health needs and not understanding that they might have anxiety. They might just feel pain and not even know that the source of that is anxiety. And so they have to find creative ways to address their needs without making them feel like something's wrong with them.
Nargis, before we let you go, tell me, from your reporting, what do you think is really going to be most meaningful in bridging some of the barriers that we've discussed?
The biggest thing is hiring, educating, and supporting more Bangladeshi healthcare workers, and then educating non-Bangladeshi people on how to care for Bangladeshis. So just creating more institutional knowledge, healthcare certificates. There's been a large gap of learning Bangla in a professional setting to be able to work in healthcare settings that are available in Arabic or Spanish in some communities. There's just also a lack of connecting with the community to find out what they actually need. And so I think periodically checking in with people and saying, how can we help you and what is the most meaningful.
Nargis Rahman is a reporter for WDET. Her work elevates voices in immigrant communities and other residents in Metro Detroit, often underrepresented in the mainstream press. You can find her series Shusto about Bangladeshi women and healthcare in Metro Detroit at WDET.org. Nargis, thank you for joining us on the Metro.
Thank you.
From the WDET newsroom, the U.S. Department of Homeland Security has subpoenaed Washtenaw County to turn over its I-9 employment forms for inspection. The forms are required to prove work eligibility in the United States. The Trump administration has been using such inspections to find undocumented workers. County Commission Chair Katie Scott says she's consulting lawyers on how to proceed. Scott says the county is committed to following all federal employment laws while also protecting the rights of all Washtenaw County employees and community members. Up next, we'll hear about what one Detroit organization is doing to support the mental health of young people in the city. This is the Metro. Stay with us.